Goitom Goromascal is coordinator of pharmaceutical store at the Ethiopian Pharmaceutical Supply Agency, Mekelle branch, and he says his agency has received 3 trucks of medical supplies so far, but it's not enough to accommodate thousands of patients who are in dire need of medicine, and essential supplies are still out of reach.
Around 3 trucks of medical supplies have arrived so far. Vaccines have also arrived by planes today. Essential supplies for HIV, TB, family planning and malaria have arrived. But the problem is they are not enough to cover the demands on the ground. Based on our conversation with the main office, initial stocks have begun to come. I can say it is better than before, but we still need much more supplies.
Another expert at the agency, Waldegirgus Biraga, a forecasting expert, also says essential medical supplies for chronic illnesses such as cancer, diabetes and hypertension have not yet arrived, and patients are suffering today despite the arrival of some basic medical supplies recently.
Medical supplies should come continuously and in full amount. TB medicine has started to come in small amount. Only 5 of the 4 needed items have come so far. But medicines for chronic illness such as cancer, diabetes and hypertension are still inaccessible. We will keep our communication with the federal authorities to send us the necessary medical items with sufficient amount. Patients suffering from cancer and diabetes will die soon unless the most needed supplies arrive fast.
Hewan Samara, deputy head of the Ethiopian Pharmaceutical Supply Agency Mekelle branch, on her part says health institutions across Tigray have been out of service as the agency had run out of essential medical supplies.
We have had numerous problems because we are out of stocks. This means health institutions wouldn't provide services. There haven't been medical supplies for the past 2 years, and patients across Tigray, including children, women, and the elderly, have suffered a lot.
It is to be recalled that the World Health Organization stated last week that the peace agreement between the Ethiopian government and the Tigray government authorities has not yet resulted in unfettered access to humanitarian supplies as promised, and the amount of medicine arriving Tigray is not enough compared to the massive demand on the ground.
The agreement should be implemented in full, and as Mike said, of course there are some food aid and medicine being delivered, but unfettered access is what we expect because the need is massive.